My name is Caleb Sullivan. I am a University of South Alabama student nurse, and I'll be performing my medication administration checkoff. And I'll scan the room. First thing I'll do is I'll make sure I'm in compliance with my agency's no interruption zone policy. I will have the doors closed. I will not field any phone calls, and I will limit all conversation with colleagues to only essential information. Okay, next thing I'm going to do is I'm going to compare my patient's MAR to his chart, making sure I have the right patient. Jaguar J. Jones, medical record number 4176352, medical record number 4176352. Making sure I have the right medication, Novolin R U100 insulin, also called regular insulin. Okay, Novolin R U100 insulin, or regular insulin. Right dose, 10 units. 10 units. Right route, subcutaneously, and right time, 30 minutes before meals and 30 minutes before meals. And I can see that the patient has not had it within the last few hours. And I will also assess any allergies. So I see there's an allergy to penicillin and penicillin. So next thing I'll move over to the medication area and I'll perform proper hand hygiene. And I'll make sure to grab the right vial of medication. And this will be for my first check for accuracy. I see that I have Novolin R, U100, or insulin or regular insulin. And the expiration date is 12/1/2025. Okay, next thing I will check for the right time, which is 30 minutes before meals. And I can see if the patient has not had it within the last few hours. Next thing I'll do is I'll check for the right route, which is subcutaneously. And for this subcutaneous injection, I'll be grabbing a 100 unit insulin syringe. Next thing I'll do is I will cleanse the top of the vial with an alcohol pad going in a circular motion. And I'll be, for the order, I'll be drawing 10 units. So I will remove the cap. Now I will draw 10 units of air. Okay, I will then place this into the vial and release the air. And I'll be sure to withdraw more than 10 units of insulin. That way I can properly remove any air bubbles. Okay, and then I'll return it to 10 units. Okay, I will place the cap back on using the scoop method. I would like to note that my insulin syringe does not have a safety. Okay, and I would compare this again to my MAR, making sure I have 10 units and 10 units. Okay. And at this time, if I needed another nurse to verify my dose, I would do this at this time. Okay. And now using my vial and my syringe, I will do my second check at accuracy, checking the right medication. So Novolin R U100 insulin or regular insulin. Novolin R U100 insulin or regular insulin. And I would also check the right patient. So Jaguar J. Jones, and then I would do the medication. So Novolin R U100 insulin or regular insulin. Novolin R U100 insulin or regular insulin. The right dose, 10 units, 10 units. Right route, subcutaneous. Right time, 30 minutes before meals, and then 30 minutes before meals. And I can see that he has not had it within the last few hours. So at this time, I will prepare a medication label to place onto my syringe that has the right medication, which is Novolin-R, U100 insulin, or regular insulin. Which also has the right dose, which is 10 units. And the patient's name, Jaguar J. Jones. I will apply this label to my syringe. Okay. And I will now be ready to go to the patient's room with my MAR and my syringe. I'll first apply hand hygiene. And I'll check the patient. I'll verify the patient's identity using two methods on the wristband. So Jaguar J. Jones, medical record number 417-6352, medical record number 417-6352. And I'll assess allergies on the wristband. So I see penicillin and penicillin. At this time, I'll also ask the patient if he had any other allergies they needed to be aware of. And also at this time, I would perform any pre-administration assessments that was needed for the medication. And then I would do my third check of accuracy, making sure I have the right patient, Jaguar J. Jones, medical record number 417-6352, medical record number 417-6352. Making sure I have the right medication, Novolin-R, U100 insulin, or regular insulin. The right dose, 10 units, the right route, subcutaneously, and the right time, 30 minutes before meals. And I can see that he has not had it within the last few hours. So at this time, I would explain the procedure to the patient. So Mr. Jones, we will be performing a subcutaneous insulin injection today, and you should just feel a little pinch. And then I would raise the bed to a proper working height and lower the side rails. And at this time, I would apply my goggles and clean gloves. Okay, and I would select the proper injection site. And for this insulin injection, we will be performing it on the dorsolateral aspect of the upper arm, which is 3 fingers down from the deltoid insertion on the humerus and 3 fingers up from the olecranon process of the elbow. And on the lateral portion of the arm. Okay, since this is an insulin injection, we can go at 90 degrees and we do not need to aspirate. And I would assess the skin and muscle, the integrity of them, and look for any signs of bruising. Okay. And then with our new alcohol swab, we would cleanse the area in a circular motion going from inner to outer. Okay, and we would lay this here, pointing in the direction that we've already cleaned. Okay. And I would now remove the cap. Immediately putting it in the sharps container and go at a 90-degree angle while pinching the skin, slowly releasing the medication, and immediately disposing into the sharps container. I would apply pressure. And I would return the patient to a comfortable position. I would lower the bed to the lowest position, lower the side rails. I would remove my gloves, and glove to glove, and skin to skin, putting it in the trash can, my hands pointed that way. Perform proper hand hygiene. And I would assess the patient for any reaction to the medication. I would then do my 6th right, which is documentation. I would document the procedure and how my patient tolerated it. And then according to the medication, I would come back. I would come back again later and assess for any reaction to the medication. And this concludes my medication administration checkoff.